So we're almost ready? Almost. And please be sure and remember our new online registration site, cancerconvention.org. And there are some forms. These are available at the registration desk and on the literature table. So please take advantage of that because I think it will make the operation more efficient. And by making the operation more efficient, it allows us to even expand on we'll have more time to really utilize the intimacy that I think this conference presents that many of the others do not. Okay. Good afternoon, ladies and gentlemen. We're very happy to have you and our next speaker at the 46th Annual Cancer Control Society Convention, Labor Day weekend 2018 in lovely Hilton Hotel in Glendale, California. Our next speaker, Dr. Ricardo James, and I think close to 40 years when he started his practice in Tijuana, carried it to Juarez, Mexico, across the border from El Paso, and he's here today again to tell us about the Good Samaritan Medical Center. Dr. James Ricardo.
Thank you, Frank.
Muchas gracias.
Muchas gracias. Well, thanks a lot to Frank and Lorraine, and it's a pleasure and an honor to be here. I used to work in Tijuana, like Frank said, with Dr. Harold Manner for 7-8 years, working with cancer patients. And then, well, I think God gave me the opportunity to work with Dr. Harold Manner, which was the leader of the metabolic therapy. And then when he died, I decided to move to my own house, which is in Juarez, Mexico. By the way, I'm American. I was born in the United States, but I grew up in Mexico. So if there's a war in the United States, I run to Mexico. If there's a war there, I come here. Well, when I moved over there, they offered me to a job as a medical director of a hospital. And 1 month later, somebody called me, Dr. Ray Evers. They called the grandfather of the chelation therapy. And then I was there working for him for 7-10 years easily. And he died. And well, I learned a lot from Harold Manner, Dr. Harold Manner, that is resting in peace, as well Dr. Ray Evers. The gentleman, Dr. David, that he did the presentation, I'm 100% agree with them. You know, most of my patients, let me tell you how I treat my patients. When one patient comes to my clinic, I listen carefully, slow. I put the patient in front of me, sits in the table, I sit down, and I put the wife on the side. And then I ask to the patient, do you smoke? And he said no, and the wife said yes. And then, so, you know, because you tell the doctors whatever you want. But, you know, it's very important to listen carefully, very carefully to the patients, because if you listen to the patient, you will save a lot of time and money in unnecessary tests, CAT scans, and MRIs. And so it's very important to listen to the patient. After I've listened to the patient, I do a truly physical examination. Take me about 2 or 3 days to know where the patient is, and then I say myself what I will do if I'm this patient, because that's the best way to treat the patient, you know, put in the shoes of the patient. You know, one time I have just to let you know, I receive patients with the cardiovascular disease, with blockage of the arteries, which is the number killer in America, and cancer patients, and some other diseases. Anyway, so I got a very busy practice. I don't do too much promotion. My patients do the promotion for me, and I really keep a busy clinic, and I got a wonderful staff. very good doctors, and I try to offer to them what is the best for them. Again, I treat my patient like I was the patient. One day, and I will never forget this day, because one little girl and his mother and his father came to my clinic, and this little girl, she was 13 years of age. That happened about, well, my son, I got three sons, my older son was at that time 13. So this young lady have a cancer, osteosarcoma on the leg. And then she's an Amish patient, you know the Amish patient. Well, I say, this is a tough case. And then I went home after I talked to the patient, and they say, well, they find osteosarcoma in my leg, the mother, they want to amputate, and then chemo, and then radio. And well, osteosarcoma is one of the tough ones. Really, it's one of the tough ones. It's was a big challenge for me because, well, I was in little Lobaina. Lobaina is her name. And well, I got a son at that time. He was the same age. So I said, what I will do with this patient? Well, I went home. I take my time, and then I think about my patients, because when you're a doctor, you don't forget about the patients. You left the clinic, you go home, you take your own time, but then you think what will be the best. So the next day, I went to see the patient, and I check, and I say, well, there's a way that we cannot amputate the leg. And because I called one of my college, one doctor who worked with bones, bone specialist, and he said, we can remove the piece of bone that get cancer and put from the other leg in the other leg. So that's what we did. And then the surgery went very well. The cancer was just on the leg. But when it is osteosarcoma, they need to go for chemotherapy and radiation. And I say, because it's very important to me to listen to the patient and tell the options, and then you decide. You are the boss, not me. You are the boss. Tell me, what do you want? This is we are here, and for your daughter, I think it's important to do all my treatments, which is high doses of vitamin C, ozone, chelation, immunotherapy, and we need to use chemo, a little bit of chemo. And not a little bit. Let's do things right, because this is a girl. This is a little girl, 13 years of age. Well, guess what? She said, "Okay, go ahead. We start to give you my treatments." A few days later, we start with chemo, and she did well. She did so well that I say, "Go home. There's a Shriner Hospital, and you don't need to pay anything. They give you everything free." Because in Shriner Hospital, that's what they do. I really respect them, because what they do, they don't pay any cent. Anyway, she went to United States, to Pennsylvania, and then she took another chemo. Well, guess what? She gets so sick that she almost died, so she went back to the clinic. Amish people don't go on airplane. Most of them, they go in train. So to go to my clinic takes about 3 days to them to get to my clinic. So when they come, I really pay attention in what to do. So this lady, the mother, Fanny, came and said, "Dr. James, I don't want any more chemotherapy for my daughter. If she's going to die, well, that's the Lord willing. She's in the Lord's hands, but I don't want any chemotherapy." I said, "That's fine. Let's do my treatments." And my treatments is the result of Dr. Roy Evers, Dr. Harold Manner, and my own experience. So anyway, we start with my treatments. She started to do well. Then I sent her home. She was doing well. And then 6 months later, she came back, and she was doing well. And about 2 months ago, I was in her house. That's a miracle. That's a miracle. Doctors in America, they think are gods, little gods. If you don't say what they do, they get mad and they don't want to deal with you anything at all. When you talk in America, doctors don't talk to the patients. Doctors avoid the patients I don't know for what reason, but there's no communication. You need to have the trust of the patient, the trust on you and the trust on the Lord, because He's the healer. We are just instruments, okay? So this lady is 23. My son is 23. He's going to be a doctor. He's finished almost the medical career. And, well, I'm so happy because that happened. You know, let me show you some pictures. That's Dr. Harold Manner. He was a great man. He was amazing. Then Dr. Roy Evers, that's me, when he was in Juarez. He called me one day he used to have a clinic in Alabama, and he used to have more than 100 patients every single day. The only problem this gentleman had is he was a workaholic. I mean, he worked day and night and Sundays, and well, you know, we start to see patients even now. I start to see patients at 5 in the morning because I say, how come 5 in the morning so early? Well, if they want to get better, let's do it. And we keep the patients busy. Okay, that's Dr. Roy Evers, which is resting in peace. About 25 years ago, I was here with him, you know, on his side, and I really learned. One day, he was in the restaurant, he was like 85, and then he was eating a hamburger. And I say, how come, Dr. Evers? You are the very famous, the more holistic, and you're eating a hamburger? Yes, he said, do what I say, not what I do. So, you know, I understand. And then, you know, I learned because one day he asked me one question about one patient, and I started to do this. I was young and kind of, you know, not as smart or put it, whatever, you know. But I started to do this, and he said, hey, wait, I'm dying. I'm going to die pretty soon. I don't have time. Yes or no? Yes, plenty. So now I'm the way I am. With the patients, I tell you straight. I don't fool around with them because our patients are human beings. They are not cars. Cars, they can change. You can leave it there and no problem. Next one. Well, that's where I am. Where is the star? That's in Texas, El Paso, and Juarez is like San Diego and Tijuana. I receive patients from different parts and from Canada. One thing Dr. Evers used to say, and I'm 100% agree, that in the United States, you don't have a health department. You got a sick department because people need to be sick so doctors can keep going. That's true completely. You know, I agree with that 100%. Well, that's to go to the clinic. You can go in train. I put a train because the Amish, they don't use airplane. So they go all the way in train from Pennsylvania. 3 days ago, I was in Missouri, and now I'm here. Well, this is Juarez, Ciudad Juarez, Mexico, and El Paso, Texas. And my clinic is about 5 minutes from the border, from the border of the United States and Mexico. Again, they come in bus, train, they go to Albuquerque in train, and we'll go pick it up, or they go to El Paso, Texas. This is my clinic. You know, when you get in a hospital, you don't know what to do. There's so many things. They put your name here. You are laying down on bed. The diet is awful. I say, I don't want this for my patients. I don't want this for my patients. So I decided to open a clinic that looks like a house, like a home. And, well, look at that's the clinic. Looks like a house. You know, I don't have even a sign. I don't need it because people know me. You know, they come from Pennsylvania, from New York, from different areas. Canada is worse. Poor Canadians, you know, they don't have choice because in Canada, medicine is free. So when they find cancer in somebody, they say, we find cancer, come in 3 months. You are not going to wait 3 months to be treated. So they run to the clinic. They call me, and here next day they are there, And again, I keep let's go inside of my clinic. Okay, this is outside, and then I got a patio. This is the back of the clinic because the patients, and especially the Amish, come with companions, with children, and everybody, everybody walk. They go to the restaurant. We got a nice food. That's an inside patio that they go outside. I got a clinic of 40 rooms, so I got a gym at the clinic. There's the rooms, different sizes, because sometimes I receive like one. Right now, if I have a patient that he's a child, 7 years of age, that they found cancer on the brain. It's one cancer that is one of the most aggressive ones, and then they find it out. They want to do chemo. They call me. I say, well, this is a tough case, but if you want to bring them, I will do my best. I never guarantee to any of my patients nothing. The only thing I can guarantee is that I will do my best to take care of them. And that's what I do, and the Lord will decide what is going to happen. Well, that's on the kitchen, the food is very important. That's one of the major treatments. That's nurse station. That's a hospital. You can see it's a good-sized hospital. We got capacity for 40 patients. In one time, I got 30 patients. At this moment, I got about 30 patients. And, and they are Amish, they are English, they are from America, they are from Canada, but they are got a mixture. And, I'm very simple. I try to use simple words. I don't complicate. I talk to them, and they become patient's friend. And when they trust, when you got the trust in your packet of the patient, when they trust you, you can do wonders. Well, that's a patient with breast cancer. We know breast cancer is the #1 killer of cancer, and the way to treat it, before they used to do mastectomy and chemotherapy. Now we try to avoid surgery. Maybe we can do a lumpectomy, and then my treatments, which is the chelation, high doses of vitamin C, ozone. This is a patient. Sometimes patients come like that. That lady came from Canada, and when she arrived, she don't announce me. She don't say anything. She just get out of the clinic, and I see her. I say to the husband, take her home because she's going to die in the next days. She went home, and she died 2 days later after being at the clinic. And the husband called me and say, thank you, Dr. James, because it was too late. You need to recognize your limitations. This is prostate cancer. Prostate cancer is one of the cancers that you can treat very well with drugs, and they respond very well. Many people die, and when they do the autopsy, they found cancer, but they never was aware that they have cancer because they never showed lung cancer. If one of these days, I never smoke. I don't smoke. I'm not a smoker. But people who if you want to die sooner, keep smoking. That's what I tell my patients because they got the package, and I'm almost through. I take it and throw in the garbage and forget about this. I don't do that, unless I got a lot of confidence with the patient. But I say, if you want to die sooner, keep smoking. If you want to live longer, stop smoking. Why? My father died when I was 14. And he was 40. So I used to go and buy the cigarettes for him. And when he died, I realized, okay, this is colon cancer. Colon cancer is one of the most common ones, the 4 causes of death from cancer. I use my treatments. Again, I try to avoid chemotherapy as much as possible. In general, there is 2 cancers that I combine chemo with my treatments. Not just chemo, no. come here and we'll give you my treatments and we'll give you chemo. And I call the ones who do chemo, and they handle pretty well. You know, the two types of cancer are lymphomas and leukemias. They respond very well to chemo. And if you use the treatments, the natural treatments, you combine treatments, you got better chances, and people respond much better. Well, this is a gentleman with a tumor on his on the neck, big tumor. Sometimes they come like this. After the treatments, he responds very well without chemo, without radiation, and he used to live in the mountains. He don't like to be around people. He was a kind of unique patient, but he came back 6 months later, and then he decided to don't come anymore. And when he came, the cancer was all over, and then he died. Well, the chelation therapy, the number one killer in the United States is heart disease, cardiovascular disease. The doctor who was here, he was very right. The calcification of the artery. Well, chelation is one of the best ways to remove the calcium deposit from the picture that he showed you with the artery that is blocked, full of calcium. When the patient arrives at the clinic, one of the tests I do is a Doppler, an EKG, to see how's the heart and how are the arteries. So I explain to them, look at your arteries, they got 40% blockage, the carotid, and I explain them, and then before they leave, I take another Doppler, and they improve a lot. I mean, I'm every day I'm more convinced about this treatment. This treatment is one of my favorite ones, is ozone therapy. Ozone therapy is legally in Mexico, is legal in Germany, but not in the United States. Forget it, So that's one of the main therapy. You take the blood out, 200 cc of the blood, you inject ozone, transfer to oxygen, and then cancer cells die. This is one of my favorite patients, and there's a different ways to do it. Through the IV, through the skin, through the rectum, and that's the ozone. The patient get in there and with his face outside, and they get the ozone. HBO. That picture was taken when I was maybe about 30. I'm about almost 60. So 30 years ago, this treatment, American doctors used to say, that's a fake treatment. Well, Dr. Everett, that machine is from Dr. Everett. After he died, well, I was using all the machine and the equipment because he gave me all to me, and he said, keep doing what I do. Don't change it. If something new comes, you can add it. But please don't change the chelation, because he has spent his life doing chelation. Do you remember Dr. Everett, right? Yes, he was here, and I remember also. HBO, again, was a fake. Now you go to a hospital in the United States, and all the hospitals got HBO, and they got a big chambers, and they make a lot of money, and 20 people get together, 10 people, they get together to the hyperbaric oxygen chamber. One day, one patient called me, and what kind of treatment I have? Well, I say by the phone, well, we got chelation, this and this, and then, and we got HBO. No, I don't want to watch TV, he said. That's true. There's hyperthermia. I am a great believer in hyperthermia, and also in detoxification, immunotherapy, and all these treatments. This treatment I buy here 1 year, and works pretty good. You need to remove the toxins. That's the colonic, where you clean the colon, because you need to remove toxins from the body. The beam right, well, this works through light and through sounds, and it's very important therapy at the clinic. Physical therapy is also So you need to treat the body in a holistic way, the whole body, mind, body, and spiritual. Now, many years ago, there was a man, Hippocrates. They called the father of the medicine. And he said, and when you become a doctor, you make a judgment. You say some words that you will work, you will help the people, no matter what color. But he says, let your food be your medicine, and let your medicine be your food. That happened thousands of years ago, and still that's completely true. Well, I really appreciate, and it's a pleasure to be here. Thanks a lot.
Ricardo, thank you so much for being here.
You're welcome.
Will you be around the rest of the day?
Yes, sir.
Okay, and so you can, I'm going to get you over to the book house for a while, but also you'll be